Welcome to New York City Health and Hospital Kings County YouTube podcast. I'm Dr. Melissa Lee, Director of the Lifestyle Medicine Program. We are taking over this season's podcast to really focus on the launch of our Lifestyle Medicine Program. In this episode of our Lifestyle Medicine podcast, we are joined by Yandra Doering, our registered dietitian. Thank you so much for joining me today, Yandra.
Thank you for having me, Dr. Lee. This is a really great way to talk about lifestyle medicine.
Nutrition is such an important part of lifestyle medicine, and it's one of the key pillars. And so we're really excited to kind of dive in and learn a little bit more about the skills that you add in being part of this program. As part of our program, you are meeting with our patients weekly in these groups. That's really a fantastic opportunity for patients.
Yes, it's really fun because it also taps into another pillar of lifestyle medicine, which is building healthy relationships. And we get to discuss and learn what they know already about nutrition and how can we support them to acquire new skills and eat more plant-based meals.
Fantastic. So let's dive right in. You just mentioned plant-based meals with fruits and vegetables. So can you tell me more about your definition of a whole food plant-based diet?
A whole food plant-based diet emphasizes eating whole, unprocessed plant foods while avoiding or minimalizing some animal products and processed foods. It also emphasizes eating foods in their most natural form, focusing on fruits, vegetables, whole grains, legumes like beans, lentils, peas, nuts, and seeds.
So Yandra, tell me a little bit more about how having a diet that's plant-based can actually help you to have a healthier gut.
So plant-based nutrition can significantly contribute to a healthy gut in several ways. One of those ways is that plant-based foods are really abundant in dietary fiber, which serves as a crucial nutrient for the gut microbiome. Fiber cannot be digested by human enzymes, but it acts as a prebiotic, providing food for the beneficial bacteria in your gut. Some examples of prebiotic foods would be foods like onions, garlic, leeks, asparagus, bananas, whole grains, and legumes, which are rich in these substances that enhance the growth of these beneficial bacteria in our gut. Also, plant-based foods are packed with phytochemicals. These are some compounds found in plants that have various benefits. Some phytochemicals, such as polyphenols and carotenoids, have antioxidant and anti-inflammatory properties that can protect our gut lining from damage and promote the growth of beneficial bacteria.
So it sounds like plant-based nutrition is all about fiber and phytochemicals. Sounds like we should really get that water out and that it will help our gut feel healthy from the inside, and also probably help relieve some symptoms for folks struggling with constipation and motility as well.
Absolutely. Drinking enough water when you are eating more plant-based foods is essential because otherwise we can get constipated and we don't want that, right?
Absolutely. Absolutely. So it sounds like a plant-based nutrition is really important in having a healthy gut. How does that interact with this idea of a gut microbiome and this ecosystem that's living within your intestines?
Yes, so the gut microbiome is linked to our overall health. It's comprised of trillions of microorganisms like bacteria, viruses, fungi, and they play a crucial role in influencing various aspects of our health. Some of these benefits are like digestive health, immune function or metabolism, weight regulation, inflammation and disease, and absorption of nutrients, and protection against some pathogens, and also mental health. The gut and brain are interconnected through our gut-brain axis. The microbiome can influence our mood, our behavior, and our cognitive function. So improving the microbiome with plant-based diet involves incorporating specific elements that support the growth and diversity of our beneficial bacteria. For example, eating more plant-based foods.
This is fantastic. I mean, it really speaks to lifestyle medicine, where we're saying that there are all these different pillars that go towards helping somebody live their healthiest life. And it sounds like the gut, the brain, all these parts of our body are just so interconnected, it's impossible to separate them. So you touched a little bit on the impact of what you eat on mental health. Tell me a little more about whole plant-based foods and how that interaction works.
One way that the microbiome affects our mental health is through the impact on the serotonin levels that we have in our brain. So serotonin is a neurotransmitter that plays a critical role in mood regulation. And low levels of this serotonin have been associated with a variety of mental health conditions, including depression, anxiety, and insomnia. A whole food plant-based diet can help to increase our serotonin levels in a number of ways. For example, these type of diets are rich in tryptophan, which is an amino acid that is a precursor of serotonin. When we consume tryptophan, our bodies convert it into serotonin. However, this conversion of tryptophan to serotonin is not always very efficient. Other amino acids can compete with tryptophan for the transport into our brain. And stress also can reduce the serotonin production. A whole food plant-based diet are low in proteins from animal sources, which can help reduce this competition for tryptophan transport. Overall, a diet that is rich in plants offer a promising approach to improve mental health by increasing serotonin levels, reducing inflammation, and improving gut health and reducing stress. And this whole food plant-based diet can help to promote mental well-being and reduce the risk of mental health conditions.
Well, Yandra, thank you so much for joining us today. You've given us so much wonderful information about whole food plant-based diet. This sounds like something that is not only sustainable, but good for our mental health, good for our gut, and even those bacteria that live inside our gut. So I'm really happy that you were able to share some of this information. I'm so glad that you're going to be working with our patients to set goals and really work with them along their 6-month journey through our lifestyle medicine program. So thank you for joining us. And I can't wait to see a picture of what you're cooking for dinner tonight.
For dinner, probably tonight, we're going to have some delicious vegetables and some side of like healthy plant-based protein. And it's not going only to feed us, but it's going to feed my gut bacteria, which is going to be super happy. And hopefully that will improve my sleep tonight. So thank you for having me here today.